Hey folks, first aid in the field just got more difficult. As we deal with this new virus and our EMS systems are bogged down, first aid becomes more important and more risky. What's in our kit can make a big difference in safety, not just for patients, but for us. We need an update. Whether you're on the road or on the trail, it's hard to keep any physical distance while providing care for someone. Science will come up with standards, but in the meantime, if you're a first aider, you need to be thinking about how you're going to handle emergencies from here on out. Now, this is especially important during the early stages of the pandemic because as it rolls across the country, overwhelming EMS and first responders, rescue may take longer to arrive. If you're in urban areas, traveling, or in the wilderness, this makes first aid even more important. First responders don't need to be taking 4 hours or more on one call that would take 20 minutes in town to tend to one of us idiots that gets hurt out in the backcountry. Which brings us to another issue. Hitting the trail is a great way to regenerate and get away from all the sheltering we're doing right now. But you might want to think twice about risk management when you do it. Pushing yourselves with extreme sports like mountain biking or climbing or swiftwater paddling might just not be the best idea right now. Hospitals are overwhelmed and, well, they're also not the safest place to be. Just saying, it never hurts to think about what you're doing. With that said, let's talk about a few things that you might want to consider for that first aid kit when you're out on a day hike and you don't want to come back with a Corona you didn't order and that didn't come with a lime. So here's what the American Red Cross says about providing first aid care for a person suspected of being infected with COVID-19. First, wear PPE, that's mask, gloves, eye protection, and if possible, a full disposable gown. Then, keep your distance and give them a mask first, right? So if they don't have a mask already on, give them one to put on while keeping your distance. And then lastly, limit the number of people that are caring for them. Afterwards, you should clean all equipment before taking off PPE and disposing of it. And then, of course, for CPR, they recommend if you're not trained or comfortable using barrier masks, then for rescue breathing, then just do chest compressions, which is all good advice. Given the situation, we should probably treat every patient as a possible corona case. It's clear that people are contagious days before, if ever, symptoms appear. We don't really know how widespread it is because of the severe lack of test and trace here. Now, of course, a full isolation gown might not be practical for the backcountry. We can probably get away with improvising a poncho or a rain jacket till we have better standards. These little kits were great for the car or at home and only about $15. They've got all the PPE that's needed and even foot coverings. What are the basics that we need? Masks are now as important as gloves. You don't need as many of them, but you do need at least one for you and one for your patient. An N95 respirator is perfect, but you can get away with other things. But surgical masks or a bandana or cloth works fine for you and maybe helpers. These can be hard to get on a patient in some situations, so a few surgical masks in your kit is going to make everybody feel a lot better. They're lightweight and effective when worn correctly. Gloves, of course, are a standard in kits for decades now because of bloodborne pathogens like HIV. They also help in a number of ways for respiratory transmitted disease. I keep a couple on the outside of my kit. They remind me to put them on. You might want to be doing that with your masks now. And of course, have them accessible, and you know that if you've ever had to use them for anything more than an owie, you need more than one pair. Things get messy in the backcountry and it's hard on gloves. With this virus, the back and forth between patient and equipment adds a whole new level of probable contagion. Double or triple whatever you're carrying for gloves, and it's nice to have them in a baggie that you can just pass out to people. Here you go. Eye protection is a whole other level of PPE that you should be considering. Sunglasses, safety goggles, or just glasses, or even swimming goggles work. A face shield is ideal, but it's a bit bulky for the backcountry. Something lightweight. I found these lightweight little Survival Metrics eye shields with an eye shield, and they're just roll up little deals, and of course this film that's on them comes off to keep them from getting scratched. And they come with a strap, but I've put some elastic on there to make them easier to don. Very lightweight, easy to carry. Of course, alcohol wipes have always been a regular item in kits. Now they're even more important. You might want to carry more of these or have a little 2-ounce, 60% or more alcohol spray for sterilizing equipment, hands, whatnot. It works as extra hand sanitizer too. Next, it's possible that a different type of thermometer, got a hypothermia thermometer here, good for hypo or hyperthermia. Then we might want to add a forehead or infrared no-touch thermometer because it makes it a lot easier and safer to take a temperature. This helps diagnose a possible corona case. And this might be worth the wait if you're trying to assess and aid a patient who's coughing all over the place. One less thing to clean or stress overdoing. Another diagnostic tool that can help is a pulse oximeter to get a quick blood oxygen level. This seems to be significantly lower in corona cases. Not to mention the benefit of having ongoing pulse rate and strength readily available. There are a number of things that can lower a person's blood oxygen level, but this is a relatively small, lightweight diagnostic tool that has multiple uses. It helps if the thermometer you're using, the pulse ox, and your headlamp all use the same batteries. How am I doing? Yeah, good. Lastly, something to consider for this situation is long-term ventilation. Having a CPR mask or CPR shield is even more important than ever for rescue breathing. This is a respiratory disease, and as many of you know, CPR with rescue breathing is extremely difficult to maintain over long periods of time. 15, 20, 25 minutes is difficult enough in a practice session. I can't imagine trying to pull this off for over an hour at home or on the trail waiting for or driving to definitive care. A BVM might be a way to go with a manual resuscitator, but certainly we should step up to a good CPR rescue breathing mask, because with help you can last a lot longer. At home or on the road though, it's possible that a manual resuscitator would be a good idea. This of course is a large bag with the mask for manual resuscitation. Now, these are kind of big and bulky. There's also pocket BVMs that are much more compact. I'll put a couple pictures up here so that you can see the difference in the two. Having these in the car or at home are now going to be even a bigger consideration. Certainly a good CPR mask instead of a shield is more appropriate for that hiking kit. These are all just the basics I've been thinking about. Stuff I've been ruminating on and don't have cohorts in the vicinity to palaver with about. Let me know what your ideas are and comment below. This is not the time to abandon our ethics. It's a time to be smart and stay safe. If you haven't already, you should look up donning and doffing PPE. There's some great videos on YouTube from universities and hospitals. And since there are no live classes going on right now, I've put the PowerPoint presentation slides for my classes on my blog, at least some of my classes. So check those out if you can. And you can get other information about practical know-how for the outdoors at my blog site. It's raisedbyraccoons.blogspot.com. Thanks for watching. Stay safe. And please like, share, and comment.